Yeah, no, I heard that there's somewhere like 100 million migrant workers in India, right? And I think it's important to give people a context of a place like India, that how diverse it is. Because I mean, I think generally sometimes the feeling is that places in Asia, because we're all majority brown skin, that they're very homogenous, right? Which isn't the case at all. I mean, India, like, 50 languages, I think, or something like that, or maybe
Hmm.
even more, and all the religions of the world in India and all the faiths and all types of people of all diversity from north to south. So I don't think that sometimes in the West we truly grasp how diverse an area India is. So
Yeah.
how's that affecting everything in terms of? I mean, the nice thing about Kerala, from what I've read, is that it's a highly educated population. What's the population? About 35 million or so?
Yeah, about, yeah, roughly.
Right, so I mean that's the population of Canada, right? So,
Yeah, yeah.
we've got the population of Canada in one province in India, but you have,
It's
very,
very dense.
very dense.
Also, Kerala is very dense.
Yeah,
So everything's close together. People are moving. You feel congested. You feel the people.
when I was first in Pakistan, right, like I got really irritated because yeah, it's like the humanity, right? People are right up against each other in lineups, and then,
Exactly.
there's no recognition of personal space because of the density. We'd go to parks and open areas, and it's just like there's no place to sit, right? If you wanted to sit, you
Hmm.
basically sat right next to another family, right? Not like in Canada where you the closest family could be meters away from you. That doesn't exist
Yeah.
in places with that kind of density, and it takes getting used to, right? As people are in your there's no such thing as personal space really when you're out in
No.
public.
No.
And I don't think that people truly appreciate, when they talk about, how it must be because it's so easy to lock down the country. People just don't understand that when countries are that dense, how
Hmm.
incredibly difficult it is. Now, so one of the theories and why, okay, so actually, you know what, let's give people some context in terms of what's happening in India with the coronavirus. So, India has less than 40,000 cases and
Hmm.
around 1,100 deaths. I think they've just hit about 1,100 deaths. So, in comparison, the U.S. has over 1 million cases. I think 1.1 or even more than that, and over
Yeah.
60,000 deaths. Right, and nowhere near the population of India. So some of the theories are, obviously the quick lockdown and early lockdown that India was able to do, and especially on travel restriction, because obviously stage one transmission is travel. So that might
Hmm.
explain some of it, some of the low cases there. The other theory is that, or so here's the two things that we keep hearing about of countries where the cases are so low and the death rate is so low. One is testing, right? Oh, India has one of the lowest
Yeah.
testing rates
Yeah.
in the world, which is true, right? And I mean, again, that also has to do with a far flung and dense population, right? But India's testing rates are very low. But you know what? Even in that, then you should be able to project some sort of percentage, right? Like, okay, so if you're testing, 100,000 people, what percentage of that is actually showing up as being infected? And India's is very low. India's infection rate out of the testing is only like 4%, and the
Yeah.
U.S. is close to 20%, right? So
The recovery rate is really high here also, which is another surprising stat compared to the other countries that are going through the same situation. I think
the
roughly
recovery rate, oh,
40,000
really?
infected.
Hmm.
Yeah, around 20,000, and a bit, and some change more than that have already recovered from the virus as well.
Yeah, see, so like, these things are very interesting, right? Because I keep telling people that it's not just about the ability to lock down so quickly. I mean, I think early lockdown is a big reason why a lot of these countries are successful, because I think that, our the preparedness in places like South Asia is a much higher. If anything, that has to do with quick response is because, places like India, Pakistan, Bangladesh, all of these regions, we have some sort of major disaster every year. You know what I mean? So the
Yeah.
ability for people to react and the preparedness is just at another level. I think that has to do with it. I think people, even on a personal level, are prepared to react to things that affect, a large part of the population or even the entire country.
Yeah, definitely. And that's really interesting because even from where I'm from, the state that I'm from, Kerala. So starting out in mid-March, we were the state with the most number of cases. So about maybe 10 to 15 cases. We were the number one in terms of coronavirus cases in India. And now if you look at the list of infections, we've dropped down almost till maybe in number 15. So we have 29 states. We're around maybe 15, 12 like that. So again, this has been the case because the previous years we had another virus here called the Nipah virus, which is another virus that was transmitted from bats. So the coronavirus theory also is that it was transmitted from bats. So in our state, we've been fortunate to have that initial systems and SOPs and also that medical infrastructure in place for this Nipah virus, which happened about 2 years ago. And so the same systems and procedures have been able to be implemented in this situation also. So, and that's one of the reasons that we've been able to drop down in that grand scheme of number of cases compared to the rest of the country as well.
That's really interesting, because obviously the projections were that India, because of its, poor health system and density, would be, very affected. There would be millions of cases and millions of deaths, right?
Mm-hmm.
But and this is what I keep arguing with people as well. I think that people underestimate how well prepared countries that have to deal with something constantly are for these kinds of situations. Versus in the West, the last time we had a case like this was over 10 years ago, right? In 2008, 2009, right? So, we're much less, and I think that there's forced learning there in places like India, where you just have to always be prepared for the next thing. And be able to quickly react to them. And it's not so much of, whether or not it's an authoritarian regime, it's just like that quick response time that the population has in order to react to these kinds of national instances.